So good morning and good afternoon, everyone. Thanks for joining us for today's webinar hosted by Prevention Plus Wellness, LLC, located here in somewhat beautiful St. Augustine, Florida, as we await yet another hurricane coming our way. So I'm looking out and we're already getting bands of wind and rain, and so it's going to be interesting. Hopefully it's not too intense. But thank you for joining us. I know you're all busy, and I appreciate you spending time with us. Today, a little bit different. Rather than the typical 1 hour webinar, we're going to do just 30 minutes. And in fact, I'm just going to do 20 minutes. I'm going to go through these slides. And that's why I want to emphasize this is a very brief intro to Prevention Plus Wellness programs and professional training. So the slides are there. There's plenty of slides. I could talk for a whole hour on this, but I'm going to go through the slides very quickly. And so that only 20 minutes of this 30 minutes will be covered with content, and then 10 minutes for you guys to ask questions. So you can do that through your Q&A option on your toolbar. Okay, so find the Q&A and that's where you'll go. And if you have questions and comments as we go along, you could type those in at any time, or you could wait till we're done at the end of the 20-minute period. So I'm going to go through these slides rather quickly. My name is Dr. Chudley Wirch, and I'm the founder and CEO at Prevention Plus Wellness, LLC. Okay, so this is, again, also unlike our typical webinars. We've got 100 people, 200 people. This is a more intimate group, I suspect, and hope that you're all very much interested in learning about Prevention Plus Wellness, what we have to offer. So again, this is going to be more interactive, I hope, and allow you guys to ask me questions and get some insights as to how these programs and training might work in your particular setting. Or perhaps they don't work, but you could at least learn more about what we're offering. So you will find out today about our one and multi-session youth programs, parent programs, media campaigns, professional training, even our licensing opportunities. We're going to review the components of many of our programs and tools. And then lastly, we'll discuss very briefly how these programs are being used across all 50 states and abroad. That's Prevention Plus Wellness. That's PPW. When I say PPW, I'm referring to Prevention Plus Wellness. By the way, I will send you a recording of this webinar, this brief webinar, and I will send you the slides as well, which you can share with others. So let's start by taking a look at our programs, our youth programs, and specifically our one session or one shot or one lesson programs. So these programs allow you to get in and get out in any very busy setting, no matter where those youth are. And you can get in there for that one shot session versus, more intensive or multi-lesson kinds of evidence-based prevention programming. So these are our one lesson programs. You can see them. There's 9 of them listed here. We're going to start with Sport in the top. Sport is our original Prevention Plus Wellness program. We've got high school, middle school, elementary school versions. Then we also have an evidence-based, along with Sport, an evidence-based InShape PPW program that's for young adults, although it is being used with, older adults as well. By the way, these programs are being used for youth and young adults as universal prevention interventions for all youth. As well as high-risk youth, those that may be in sports or athletics or have been caught or screened as using substances. And so they're even being used in the U.S. military. So lots of flexibility for these programs. And since they're a single session, you can really have public health reach all youth in your school, your campus, your community, whatever your setting might be. 3 and 4 are adaptations of Sport, whereas Sport addresses largely alcohol. We took out those alcohol messages, and for the vaping PPW program, we put in e-cigarette messages, and for the marijuana PPW program, we put in the cannabis messages. I'll talk a little bit more about how those messages work. Opioid PPW is actually versions for adolescents as well as high-risk young men and young women. That's according to the recommendations from SAMHSA, the Substance Abuse Mental Health Services Administration, that have identified adolescents, young men, young women as high-risk use populations for opioid misuse. Number 6 is our video-based program. We've got sport in a video-based program. So rather than reading a script and showing slides, you simply show your program to your classroom. That's the sport program in a video format, makes it even easier to implement. And you have that, the action and the vividness of video of young people in video versus still PowerPoint slides. Number 7, brand new online course, just released it. We got one of our the sport high school version in an online course, so you can actually send this link to your youth and they complete the course online on their own timeline and schedule. Then we also have racial justice and racial justice and in God's image PPW programs. I'm going to give you a little overview of all those. But here's our brand new, and I mean brand new, just released yesterday, Sport Prevention Plus Wellness program manuals. That's the cover. And you've got from the left to right, elementary and middle school and high school versions of the Sport Alcohol and Drug Prevention Plus Wellness program. Sport, evidence-based, found to prevent and reduce alcohol, tobacco, and marijuana, even though the messaging is largely alcohol use. So youth, we suspect, are drawing connections about how these other substances, particularly tobacco and marijuana, can also harm and interfere with their developing a healthier and more positive future image of themselves and lifestyle. So also, sport has increased significantly physical activity among non-using and substance-using youth. The Sports PPW program targets alcohol and other drugs, again, primarily alcohol, physical activity, nutrition, including both breakfast and fruits and vegetables, particularly sleep and stress control. It's a single session program. It can be implemented in, I would say, as little as 40-45 minutes or as long as you want. It includes evidence-based practices, screening and brief intervention format. All Prevention Plus Wellness programs use an evidence-based practices, screening and brief intervention format. Number 4, like most of our programs, and maybe all of them, they're implemented with slides. You show these slides with images and vivid imagery terms like fit and active and healthy and successful. And those are designed to cue or to trigger unconscious future images of youth, very motivational. And then we link how substance use interferes with those outcomes. Behavior image theory. Behavior image theory is the behavior image model is the theory or the conceptual basis for all PPW programs, emphasizes using positive image communications to motivate and to initiate behavior change. Also included in your sport programs, optional parent flyers, and you get a physical manual with your scripts. You read the script to the youth. You can implement this to youth one-on-one or in a group setting. And you can also provide this virtually. So there's slides in your program kit that allow you to present this virtually, like over Zoom or Microsoft Teams or whatever platform you'd like. So a lot of flexibility with your sport PPW program. Here's your table of contents in your sport program. Introduction, directions, you get a scripted lesson to read along with your slides to one youth at a time or to a group of youth. You get evaluation materials to assess the quality of your implementation, the fidelity of your implementation. the pre-post surveys to assess immediate outcomes on your program with your youth. You also get under number 7 an additional online survey if you want to, goal plan if you want to continue to have youth set goals and monitor their behaviors beyond your single session sport program. And we have, as I said before, optional parent flyers that can be mailed out, handed out, emailed, posted on your website. PPW programs, including sport, follow this 3-step screening and brief intervention format. Step 1, screen youth for their health habits. That might include a substance like alcohol or cannabis or marijuana, but it also includes physical activity, nutrition, sleep, and sometimes stress control. That increases youth awareness of their health habits as they exist at that time. Secondly, you provide feedback on each of those wellness behaviors, those health promoting behaviors, and you highlight the benefits as well as the future images of achieving those behaviors, whether they be physical activity or eating more healthy or eating more breakfast or getting more sleep, and then how substance use interferes and harms those behaviors and the achievement of those benefits and positive images. That's step 2. Step 3, goal setting. That initiates the behavior change. And it's not just goal setting to avoid substance use, it's also to increase protective wellness behaviors, healthy lifestyle behaviors. And this over time, setting goals and monitoring them, increases self-regulation skills and self-efficacy of youth. So 3-step process: screening, feedback, and goal setting. Here's a snapshot of our InShape Prevention Plus Wellness program, 1 session for young adults, and it can be used in campuses, communities, U.S. military. Again, very, very flexible, can be used wherever there's young adults. Our 2 adaptations of sport are the vaping PPW program. That's the e-cigarette program. We have an elementary and a middle school and high school version of this program. You're actually looking at the front covers of the manuals. These programs all programs come with a digital download of the slides and of all the materials you need to make copies to implement your program to unlimited numbers of youth or young adults. Okay, so it's a one-time purchase. So very, very cost effective. The more you implement it, the less it costs per person. Marijuana PPW, same thing. It's an adaptation of the sport program, but instead of using alcohol messages and how alcohol interferes with a healthy lifestyle, healthy behaviors, and a better future of themselves, you have the messages about cannabis. Then there's the opioid PPW program. Again, a little bit different because we have versions rather than for high school, middle school, elementary school. For the opioid program, we have versions for adolescents as well as high-risk young men and high-risk young women. Sport also comes in a video format, as I said before. You just show it to your classroom. So it's easy. You don't have to have a manual to read the script, to show the slides. You just put the video on, and the video will say pause and provide your screening survey, pause and provide your goal plan. And so it's a very, very easy way. We created this for settings where an individual, maybe it's a coach, maybe it's a juvenile justice setting, whatever the case may be, where the person doesn't want to take the time to practice the script, to read the manual. They just want to put on a video. Very, very easy. That's the video program, Sport. Brand new, we've got Sport now, the high school version, in a self-paced individual youth program. So they hop on it, they take it on their own. There's quizzes, there's interaction, same positive image slides, same content, same screening, feedback, goal setting, 3-step process, but it's in a self-administered online format for youth. So we think that'll be good. And that'll be big, I think, for some settings where maybe you missed youth in the presentation in the classroom, maybe a juvenile justice setting, wherever the case might be. This is a very, I think, a very easy way to implement the sport program, online program. Racial justice and In God's Image. Racial justice addresses a risk factor for substance use for youth, that is racial prejudice. And In God's Image is a faith-based program. Both of these programs are completely downloadable for you. So you don't get a manual, you actually get a download of everything and make copies of anything you need. We also have one-session parent programs. These were created using the youth content. So for example, we've got the sport parent program, which, alcohol forward. In Shape parent program for parents that have young adults. Vaping or e-cigarette parent program, et cetera, so that you can, in a single setting, train your parents to present the same positive image and positive behavior communications and goal setting at home that you might be presenting to youth and young adults in a college setting, community setting, school setting, so that these young people are getting reinforcing messages. So parent programs, for those of you that do parent programs, you can provide a PPW parent program in one session. So it's much more practical than multi-session parent training. And here's all the materials in your parent program. You get the PowerPoint slides, and you just read the notes in the bottom of the slide as to how to present them. You get steps for implementation, and then you get this very important document you make copies of, resources that you hand out for your parents so that they can go home and continue the process of practicing providing very brief positive communications for their kids, to promote their healthy behaviors, to avoid risk behaviors, and to set goals to improve their self-control. We have two multi-session programs. One is Sport 3, which is actually a combination of sport, the alcohol program, and the marijuana and the vaping program. So you got 3 lessons, 3 weekly lessons. If you have access to youth for more than one time, if you have access to youth for 3 times, this is perfect, because you can, each week you can present a lesson, first lesson alcohol, second lesson marijuana, third lesson e-cigarettes, the big 3 substance use, most prevalent substance use among US youth. So that's the Sport 3 program. Sport 2 is actually 6 lessons, but it's health behavior forward. It has 3 lessons on different types of physical activity, 2 on nutrition, and 1 on stress control, sleep. So 2 different kinds, and that's why Sport 2 is oftentimes used in classroom settings for health education. It continues to address substance use avoidance, but with the focus on healthy behaviors. That's Sport 2, 6-lesson program. There's the Sport 3. We've got a high school, middle school, elementary school version. That's 3 lessons: alcohol, marijuana, e-cigarettes. And then the Sport 2 is a 6-session program. And we have, again, elementary school, middle school, high school versions. PPW programs in use in any setting where there's youth, in school, out of school, after school, sports, PE, health education, social studies, juvenile justice, boys and girls clubs, YMCAs, you go on and on and on. And then college campuses, military, at home, wherever you can find youth, you can implement these very brief, very positive, multi-risk behavior programs, integrated behavior programs that address not just the avoidance of substance use, but the promotion of these very essential healthy behaviors that are lacking in youth and that are associated with improved physical and mental well-being. We have media campaigns. We have the marijuana, the vaping, the opioid, and the sport, largely alcohol media campaign. So we got 3 levels of prevention: the youth programs, parent programs, and media campaigns. And so same thing, same model. Within these media campaigns, they'll include, they're multimedia. So they're print materials for posters and billboards, there's social media, there's videos, but same model, trying to get youth to think about their health habits and to set goals to improve their overall wellness. As far as training, our most popular training is our online self-paced program implementer training. It takes about 2 hours. So if you're going to implement, let's say, the sport high school program, we highly recommend that you also order up the sport high school online training. You take it whenever you're ready, start it. If you need to pause, you need to come back a day later, whatever, you got 2 weeks to take this 2-hour course. Very easy. And you have your manual in front of you. You just follow along, and the training is self-paced. It walks you through your manual, very interactive, very good training. We can also do a live train the trainer program. Now, for a train the trainer, for you to be trained to train other providers in your organization or region, you need to first have a program manual, be trained as a program implementer, implement your program one time, and then you're eligible to take the online train the trainer. We also have in-person training, but with COVID and so on, we've been doing a lot more training virtually, actually, which is very, very convenient for everybody. We have 2 3-year unlimited licenses, one for programs, one for training. And what this means is that for 3 years, you can make unlimited copies of your program manuals, and you get your digital download, and you can implement it to anybody you want, make as many copies and distribute them to anybody you want within your region, within your county, within your school district. And so it can be very cost effective if you're really trying to increase your prevention plus wellness reach. And we also have the unlimited training, which means you could send anybody to our training portal for, I don't know how many years, 2 years, 3 years, whatever it is, and they can get trained. And if you've got the unlimited program license, you give them a program manual, you give them the digital download, you give them the link to the training, and they get trained and they're off and running. More information, go to our website. On the left there, you could look at our catalog of our most popular materials. On the right, you can request a sample of any of our materials. I'm going to pause at this point and see. Now's the time to open it up. Questions, because I really went through this very quickly, and we have so much to offer. The question is, what would fit best with you? What are you interested in possibly looking at, or maybe using in the future? Because we have so much, it ends up being a little bit confusing sometimes for people. So I'm going to open up the Q&A. I don't see any questions at this point, so I'm just going to wait to see if anybody has any questions, anybody's comments. Now is your time. We've got a few more minutes remaining. What would you like to know about Prevention Plus Wellness programs for youth, or for parents, or the media campaigns for youth, the one-session programs or the multi-session programs? Anything about training? Do you want to know anything more about our training or our unlimited licenses? Now's the time to ask me. I'm happy to answer any questions that you might have. Remember, for all of you who've registered, I will send you a link to this recorded webinar, and I'll send you these slides that you're welcome to share with others in your region. Okay, no questions. I'm very surprised. Oftentimes, there's a lot of questions because there's so much here, and it becomes a little bit confusing for people. Now, those of you here may have heard this before. Maybe you're even are implementing some of our programs, but now's your last chance. If you do have any questions, now's the time to ask me, or to make a statement about PPW, or have an issue about prevention that you're wrestling with in your region. You've got a few minutes. This is your time. Use it as you like. You just go to the Q&A and type it in. Other than that, I don't have anything else to say. I hope you're all safe and you're taking care of yourselves, and God bless you for what you do for youth and young adults and families in your region. Thank you for taking time to log in today and listen to us. And we do continue to provide free webinars. This one's a little unique. We had a request from an organization saying, hey, we want something really brief and just give us an overview of everything. So this is just that kind of a thing. So it might be something that you could share with others, these slides or this, 20-minute or so webinar overview of Prevention Plus Wellness. And we're continually changing and updating. As you see, we've got the new sport manuals. We'll be working on updates in some of our other programs in the future as well. We've got the new sport online program. So we continually update things. We're listening to what you want, what you need with your youth, with your parents, in your setting, so that you can have the tools to reach all your young people, to prevent substance use and promote their whole health, and do that in as easy a manner as possible with the best effectiveness as possible, and also have a good, enjoyable experience for you and the youth and the parents. Okay, I don't see any. I'm going to go back to the beginning of our slides. Brief intro to Prevention Plus Wellness programs and professional training. Don't see any questions. Last chance. Anybody? Q&A? Happy to answer anything you might have. I don't see anything. So you guys are awesome. Have a wonderful day. Thank you again for joining us. And hopefully I'll see you in the future. If you need anything from us, preventionpluswellness.com. By the way, we're updating our website. Check it out. We're trying to make it a better user experience for you and help you find things a little bit easier on our website. If you ever need anything from us, if you ever need anything in your professional lives as prevention health specialists, ask us for it. We'll see what we can do. For example, right now, we're translating some of our programs into Spanish, and we'll continue to do what we can to help as much as we can. All right. Thanks so much for joining. Have a great day, everyone. Bye-bye.